Yeah, you can proceed.
Thank you. Thanks for the opportunity to present the Department of Health Executive Biennium budget for FY 21-23. I'd like to open with a very brief story. There are some hikers coming up on a river, and they noticed a baby floating in the water. And so one of the hikers jumped into the water, grabbed the baby, and rescued it. And as he pulled the baby out of the water, there was another baby floating down the river. So another person jumped in to save that baby. More babies kept coming. The hikers kept jumping in. Pretty soon they were all tied up, and they noticed one of their friends walking upstream towards the waterfall. And he said, "What are you doing? You got to come down here and help us catch all these babies." And their friend replied, "I'm going to the top of the waterfall to see what's causing this." That's the kind of work that we're doing at the Department of Health. DOH protects and improves the health of Hawaii's people and environment. Our stakeholders include all of our state's 1.3 million residents and 10 million visitors. And our mission stretches across your lifespan from before your birth until well after you are laid to rest. The Department of Health is the sole public health agency in the state of Hawaii, comprised of 4 major administrations: public health, environmental health, behavioral health, and general administration. The department is a direct service provider of healthcare, usually as the provider of last resort. We run programs through the purchase of service contracts to improve the health of our more vulnerable populations, and we advocate for Hawaii's overall health status through health policy. Prior to the COVID-19 pandemic, DOH prioritized 4 public health areas. Number 1, respond to and recover from emerging infectious diseases. And I know we're all thinking about COVID, but let's not lose sight of dengue fever, Zika, measles, hepatitis, several others. Number 2, regulate vaping to protect Hawaii's youth from nicotine addiction.
That's right.
Number 3, establish short-term crisis stabilization beds to address Hawaii's homelessness and mental health crisis. And number 4, implement a community medicine program to improve access to and quality of care. We appreciate the opportunity to talk about the budget as a whole today. COVID has COVID has been and is tremendously important, and it's received a lot of focus. But we'd like to respectfully request that we entertain any COVID questions in a separate conversation and focus on strategies to become the Department of Health that the state needs in fiscal year 22 and beyond. Our challenge is to be flexible and agile and to be responsive to the public health needs of our community, including as a frontline pandemic response agency for Hawaii 2021, but also to plan for the needs of Hawaii for 2022 and beyond. We acknowledge that both public and private sector must live within means. We understand that budget cuts are the start of the conversation, and the Department of Health must not only do more with less, but do better with less, and do differently with less. The DOH leadership team has been asked to plan for the post-pandemic period. Many Department of Health programs and individuals pivoted to provide critical COVID response in addition to their normal department how-might resources. Finally, I would like to reflect on our community's experience during the Great Recession of 2009. There is a cost for health program, but I urge you to think of it more as an investment than a cost. An investment that returns savings as opposed to revenue. Cuts to critical public health services contributed to shifting the community's burden to more expensive treatment and services, including an increase in homelessness and jail admissions in the period after the last recession. The budget savings of a few $1 million in 2009 became an appropriation almost 10 years later, or $30 million. and untold system costs and human suffering. My goal is to remind us that our community's health status must be seen beyond the context of a 3-year budget. This is the beginning of a conversation that will impact our quality of life for the next decade and beyond. And we look forward to a budget that continues to prioritize the health and safety of our state. Thank you again for the opportunity to make opening remarks. And I would like to ask that our deputy directors review their budget requests and impacts.
Hi, good afternoon, everybody. Kathy Ross, Deputy Director, Department of Health. I'd like to just offer some general statements before our programs go to their detailed program budget requests and conversations about potential restructuring and reprioritization. The one thing that COVID has taught us and what we're going to continue doing is to maximize the use of federal funds. And to also, we're going to we're going to focus on maximizing general funds, regular federal funds, and the COVID federal funding that is coming to our state. We couldn't have done this without the support of Budget and Finance, so we do want to thank them for their support in our ability to be flexible within the realms of state budgeting. What we also learned from COVID.
Kathy, you know, when each of you talk, can you just raise your hand before you speak? Because we can't tell who's talking because of the mask. So some of the members had asked who's talking, so if you can just raise your hand. Thank you. You can continue.
Okay. Got it. Can you hear? Okay.
Yeah. Can you raise your hand real quick though?
So what the?
Yeah. Okay. So that's Kathy Ross. She's the. Okay. Thank you. Thank you. You can continue.
Okay. So what COVID has also revealed is something that the department has known for quite some time as we experienced prior cuts, but it's revealed the need for a stronger and more robust local public health infrastructure so that we can respond more locally rather than just at the state level. And lastly, I'd like to just conclude in general, the proposed cuts that are in our budget, they're painful. We all went through the program review process with Budget and Finance. And we know that very difficult decisions have to be made. Because those cuts are in our budget, I want to acknowledge that it doesn't mean we want to give it up.
What happens if they get stuck?
Is it frozen? I think she's done.
No. Are you done?
Did they get caught?
Or they frozen? I can't tell. Looks like they're frozen.
Try us again. Try ask again.
Kathy, are you done? See, I think they're
Oh,
frozen.
they're frozen.
Yeah. Okay, why don't we recess?
Okay.
Okay, recess. To recess, and while we wait for Department of Health to get back online, why don't we move on to HHSC? So, thank you. Good afternoon.
Good afternoon, Chair Dela Cruz, Senator Inouye, Senator Kidani. Very nice to see you. Happy New Year. For the benefit of those who don't know me, I'm Linda Rosen. I am the CEO of Hawaii Health Systems Corporation. appreciate the opportunity to come before you today to discuss our budget request. Per the instructions that we received, I do want to, okay, we are able to show a few slides, just a couple that we have, and I want to go ahead and post our mission and vision statements. And our mission is that HHSC will provide accessible, high-quality, cost-effective services which address the healthcare needs of Hawaii's unique island communities. And you can see our vision is to be recognized as a progressive model for an accessible, integrated, patient-centered, and fiscally responsible healthcare system focused on assuring high-quality care to improve the health of our communities. And on the next slide, I just want to show you our facilities. Some of you may know that HHSC is organized into regional sections, and we have 5 regions, although our Maui region is currently operated by Maui Health Systems, which will present their budget requests separately. But our other 4 regions still with HHSC, you can see the facilities, and I think you can see that especially on the island of Hawaii, we are the predominant provider of hospital services. We operate, I'm sorry?
Can you hear us?
Oh, yeah, you know what? We're moving on. If you can just hold on real quick, because HHSC is presenting theirs for the moment. So if you can continue.
Okay, thank you. So you can see for yourself our facilities, and we also here on Oahu have an affiliate of HHSC, which is Kahuku Medical Center. Then per the request, I will very briefly discuss how we came to our budget request. And as the instructions instructed, I want to just briefly mention that the way that we measure our success and progress is by looking at several healthcare industry metrics, such as accounts receivable, our ability to collect from services, our accounts payable, many other metrics. As you know, we are subject to many regulatory agencies such as JCO, CMS, surveys. I'm proud to say that our facilities, a number of our facilities, you'll see in the full testimony, received 5 stars from CMS in our nursing homes. And we were also able to increase our revenues 2.7% from 2019 to 2020, despite all of the problems, which included a 7.5% decrease in admissions. So I think that is quite an accomplishment. The other things that we can measure that would demonstrate basically the importance of our program. I'm sure I don't have to mention the COVID services, but I can tell you, I think as of last week, we had done 30,530 COVID tests and administered 3,116 vaccines. And we are continuing at that pace and have made a lot of progress in getting our communities vaccinated. Quickly, the next area that was mentioned is federal funds. We don't normally receive federal funds, of course, outside of Medicare, Medicaid payments. However, this past year, because of COVID, we did receive considerable federal funds, which is how we really are getting through this year. So I want to quickly mention we got $45 million in provider relief funds. We got $20 million in paycheck protection program funds, and another $14.4 million, which are Medicare advance payments, which we may or may not have to pay back. So that really brings us to the budget request, and it is in your packets, and we have a brief summary of it on the slide for the biennium. And you'll see that the request does seem quite large, but that is because we our base that of the 105 million plus is a pretty old base. So the last few years we've been funded and non-recurring. So for instance, we were provided $127,300,000 approximately for this fiscal year. So you'll see that the request includes, previous, as I said, one-time appropriations that we're now asking, to be continued. On the major portion of our request has to do with collective bargaining raises that we were not funded for, and we have partially, of course, covered, but that still puts us behind. And we also are projecting a net income decrease of 10% based on the lower utilization that we see during the pandemic. And that is the case today. We have had some benefit from net income generating things and also some benefit from a decrease in the fringe benefit rate, which has helped us to get through this year. But you'll notice the lost revenue lines of 63 million in each of the years, and that's based on the decrease of services because people are not coming in for elective surgery, ERs, and things like that. That could reverse itself. Also, we are very carefully looking for federal opportunities such as we took advantage of this year. All those programs ended at the end of last year, but we are hopeful that they will, some of these will renew, and so that may be able to cover some of that lost revenue. I think those are the major factors that have built our budget, and be happy to expand on anything or answer questions. Thank you.
Members, any questions? Any questions online? Okay, thank you. So Dr. Char, why don't we go back to Department of Health?
Thank you.
Thank you. I think Kathy was in the middle of her statement. Kathy.
Okay, got it.
Okay, you want to continue where you left off? Okay.
Good morning. My name is Danny Montemiasu.
okay.
I'm Deputy Director of Health Resources Administration. For those of you who are not familiar with Health Resources Administration, it's your traditional public health areas. It includes 7 different divisions and offices. So it's probably one of the most diverse administrations in the Department of Health. And all of the offices as well as divisions within the Health Resources Administration have pivoted their resources and have fully engaged in the whole COVID response. So when I'm talking about the COVID response, I'm not only talking about the division you're most familiar with, which is the Disease Outbreak Control Division, who has been really the lead in the epidemiology, coordination, and policy advisement regarding COVID-19. And they are the hub of much of what the department is doing and the subject matter experts. So they provide all the science as well as the advice to respond to the COVID pandemic. We know that this has been such a great challenge for all of us, not only in the Department of Health, but across the state and across the nation. And what it has required us to do is really work together in collaboration with a lot of partners. And the information that we received from the federal government regarding the direction and the guidelines for response, COVID response, has been very challenging in the sense that it changes very rapidly. So the department is really in a position to try to be more agile in terms of response. And this has been a challenge for us, as you well know. From the very beginnings when we're looking at ramping up contact tracing and disease investigation and ISO quarantine to now vaccination. So this continues to be a challenge for us. One of the things that we hope to do throughout this process, not only partnering with private as well as public entities for COVID response, but really our ultimate goal is to build community capacity to respond not only to this pandemic, but to future pandemics. as Deputy Director Ross said, we really are looking to the future as well as to meet the needs of the current pandemic. One of the areas I think that has challenged us the most and that we are continually working on, and we appreciate working with you all on, is communication. That has been one of our greatest challenges in communicating with all the various sectors within our community. It's not just one, it's not just the legislature, it's not just the general public. I mean, there are smaller communities within the general public that we need to get the information out to. So it has challenged us all to look and work in these communities with the communities, not just to the communities or for the communities, but really working side by side with the community. And that has been our public health nurses, it has been our public health educators, it has been our district health officer staff, it has been just about everybody within the Department of Health reaching out to communities to really figure out and talk with them to see how best to communicate with them. And we really appreciate Senator Keokalole and his offer to assist us in improving our communication mechanism, and we look forward to continually working with him on that. In our budget ask, we have asked for exemption for the Disease Outbreak Control Division to exempt them from any reductions. They are a very small entity as it is, and we really would like to preserve them as the hub, because you need a strong hub in order to be able to really focus on the spokes that come out of that hub. So we want to keep that hub as strong as possible. Even with the federal resources that are coming in, and we know there are some sizable resources that we anticipate coming in, we have not yet seen the guidance on those. So we are still waiting for that, but we do still need to preserve that hub of information and that public health function. The other ask that we have is to preserve the EMS services at the current level. And we know that there's further communication that needs to be done on this and further work that needs to be done, because we do know that the way that it's currently structured, is not sustainable. So we are continually looking at working with actively working with the counties on finding ways to increase revenue generation, increase opportunities for synergy as well as integration, especially with programs that the state can already support, and with county services that may be very close in alignment or maybe overlapping. So where we can create better synergy in that respect. And that is mine. Thank you very much.
Thank you. Does this,
So is up next.
good afternoon.
Good afternoon. There's some technical difficulties with the video. Good afternoon, Chair Dela Cruz, Chair Keokalole, members of the Ways and Means Committee and the Health Committee. My name is Keith Kawaoka. I'm the Deputy Director for Environmental Health. Like the other deputies' administration, environmental health requires sufficient resources to assure the health and environment in Hawaii. We take that job very seriously. We do that by enforcing our current laws and rules, enforcing any unsanitary and hazardous conditions and healthcare facilities and related services, and providing specialized environmental health and laboratory services in Hawaii. General funds are supported mainly positions, but it also is a way to match the necessary federal funds, grants that we get, mainly from the Environmental Protection Agency. Overall, EHA has met the 20% reduction amounts in our 22 and 23 submitted budgets, although some of the listed items we feel are unrealistic. For example, We're utilizing a lot of the ODC expenses for, example, utilities like electricity, and for our laboratory, state laboratory division, that's obviously a critical expense to keep the laboratory services going, as well as the other buildings we have. Some of the budget requests that we have a request for $50 million increase in the appropriate ceiling for a revolving fund for water pollution, which includes our clean water revolving fund. Those are the funds that the counties use for low-cost loans. And as you know, it's going to take on increasing emphasis is the critical infrastructure for environmental and water protection. Overall, to meet the budget requirements, we have tried very diligently to look at how we can transfer general funds from to other sources, special funds, federal funds. And it also comes with trying to meet the dynamic situation of our vacancies. Since we have moved from AFES to Waimano Ridge, the vacancy rates really gone down, especially in some of our specific programs. But the hiring freezes and a lot of employees moving to other states, and particularly for retirements, that's really created quite a challenge for us. I just want to highlight our state laboratories division. Even though they've been in the front lines of the COVID testing and technical support, they do a variety of other support, not only within EHA, but the rest of the state. So the reductions they've had to take have really hampered some of the other areas, non-COVID areas as well. So with that, in summary, I just want to turn it over to Eddie Mercero, Deputy Director for Behavioral Health.
Hi, good afternoon, chairs, vice chairs.
Good afternoon.
Eddie Mercero, Deputy Director. Thanks for the time today. So, Chair Del Cruz, I'm just going to go through and try to answer as quickly as I can the four kind of general questions that you asked in your December 31st letter, and it has to do with the first question being
I'm not sure. I think Keith is frozen.
And functions.
Oh,
Hold on, I'm just going to try and see if I can get my video to start.
Oh, okay.
Maybe the budget should include some better technological equipment. Anyways, so the first question has to do with the mission and function. And for the Behavioral Health Administration, our mission and function is described, throughout Chapter 19, primarily or Title 19, primarily in chapters 321, 333, 334, etc. And I had a whole list of different highlight bullet points that talks about our functions, but there are some themes. The themes talk about coordinating programs, identifying resources throughout the state, both public and private, to utilize, developing a comprehensive system of care, etc. One entry that I think sums it up pretty well is 334-2, which basically generally states that it calls on us to foster and coordinate a comprehensive mental health system utilizing public and private resources to reduce the incidence of behavioral health or emotional disorders, substance abuse, and administer such programs, services, and facilities as may be provided by the state to promote, protect, preserve, and care for and improve the mental health of the people.
Eddie, can you hold on 1 second? I'm going to call a recess until we can fix this technical glitch. Recess. Okay, calling the meeting back to order. So, Eddie. I can see Kathy and Danny and Dr. Char. Is,
He's coming right here.
okay. Okay, thank you. Okay, go ahead and continue. Thank you.
So sorry, Chair, the members. So in general, those themes essentially talk about it. So I'll just go through the one that I was going through and finish it up. And it says, it really ends with states to promote, protect, preserve, care for, and improve the mental health of the people.
It's like staticky.
You asked about staffing and current staffing, and the Behavioral Health Administration has about 1,250, a little under that, 1,245 positions altogether. Of that count, we currently have about 298 vacancies. And we have about 179 of those vacancies are the new positions that were allocated for the state hospital last year. So it's a pretty low count comparatively. If you look at the overall picture for BHA, we've had some struggles hiring for a lot of positions, mostly because they're pretty difficult to fill. Some of the requests in the budget, some of the highlights is pretty minimal budget highlights and requests comparatively to the scope of our administration. And we really just talk about extending the expenditure ceiling for developmental disabilities and including refunding some positions that were unfunded last year, as well as fully funding positions that were allocated for 6 months that were half allocated last year for the new positions for the state hospital. Talk about lessons learned. Behavioral health has been working really hard to continue not only our initiatives that we're supposed to do, and we started talking about last year before COVID hit, for example, revamping the mental health care system on the stabilization beds, etc. But also helping to do our part in the department to help support the initiatives for the COVID response. So a lot of those initiatives include stabilization beds, isolation and quarantine sites, most recently helping with vaccinations. We think that we've done a pretty good job. I think my staff have a pretty high GSD factor when it comes to student up and showing up. And I think in terms of our lessons, we find that BHA is much more effective when we think outside of the proverbial box, so to speak, especially our organizational boxes, and just bring people together where we need to accomplish the tasks that are before us. And we really believe that in order to become the Behavioral Health Administration, similar to what Director Charles was talking about, going into the future from 21 and beyond, and we're going to need to continue to do that, to think outside of the box, to restructure how we operate, rethink what we do. One example is taking the lessons and the activities that we've been able to have engage in and the opportunities that have come from this crisis. For example, telework. Because we've instituted telework for COVID and we plan to, and it's actually really worked out, and we plan to try to keep it going for a lot of our staff. We're looking at potential cost savings of $500,000 over the course of the next year for once we renegotiate some office leases and equipment leases. And then we can then turn those cost savings back into telehealth services for the state and other services like that. In terms of changes in the budget, I think I would just humbly echo Dr. Char's comments in relationship to looking at behavioral health as an investment in the future that doesn't result in a lot of revenue It results in a lot of cost savings down the line over the long term. So, thank you very much.
Thank you. Any other comments from,
That concludes the Department of Health. Mr. Bologna, and we're available for questions.
thank you. Members, questions? Questions?
Yeah, for the Department of Health on the ambulance, on their spreadsheet.
Which table?
Active contracts. Dr. Char, can you explain on your active contracts, the table, I don't know what table this is, active contracts as of December 1, 2020. On page 151 and pages 153, you have the exact same language. One is 182 million max value for 9/11 Advanced Life Support Emergency Ground Ambulance Service. And then you have the same thing on page 153, but for $31.5 million. Is that the same contract? I'm not sure why it's split.
Well, Dr. Bronson, Dr. Bronson will answer that too.
Okay. Is the duration of that to be 2 years, or is that 1 year on that form? This is Dr. Bronstein here.
Look at table 17.
It doesn't say, I don't know.
So it's all broken up.
It's the same language. Possible extension to 6/30/2023. But one is for 31.5 and the other one is for 182 million. Page 151 and 153.
Okay, I think that could be several things, maybe the general and special fund split. If it would be okay, please allow us to go over that and get back to you with the explanation, and I think that'll be the best thing to do, say, rather than speaking off the cuff.
Okay, thank you.
If that's all right with you, ma'am?
That's fine.
We'll get back with you with the answer. Thank you.
Thank you.
Any other questions?
Yes.
Oh, go ahead.
Oh, okay. Environmental agency, can you talk about the deletion of positions in the vector control and what island that is as well? I think you're deleting 2. Are there any other deletions for vector control on any other island? Or where the deletion is?
I believe Senator Yowei, the unfunded position for vector control is for Vector Control Inspector 3 on Hawai'i. I'll ask Nancy Barter to clarify that or add to that.
Okay, it's worker position 2, the control worker. It's on your table 5, page 62. And if there's any other position deleted in the vector control as well, or is this the only one?
Nancy, are you on?
Yes, I think I am.
Yes, you're on.
Okay, Senator, actually, a number of the positions were unfunded by Act 9 last year. We have funds to be able to save one of them. So we are transferring funds to save one vector control inspector's redesign. But the
What
rest
island
of
is that one?
Kauai,
Kauai.
yes. But the other position in vector control that were unfunded, we don't have any money to be able to transfer around to save. So there's also an epidemiologist from Kauai that would be, that we have a request in to reduce that because there's no funds. And then there's a vector control inspector 2 on Hawai'i Island that has no money to support it. In addition to that, in the program review, we've actually needed to reduce 7 positions from vector control.
Wow.
So
That's this year or a combination of last year's? So this year,
that would be for the next biennium, FY22 and FY23.
so you're thinking of deleting 7 positions, you say total?
Yes. The entire Environmental Health Services Division had to put a reduction of 12 filled positions on the program review in order to meet the target 20% reduction amount.
Was any monies from the CARE Act the past year used to at least supplement some of the positions?
We haven't, in HTH 610 has not received any funding for CARES Act. I mean, unless the people were doing COVID-related duties and did overtime, for example.
Didn't the department use some of the vector control personnel at the beginning of the quarantine situation, that they were used for part of the program, my understanding?
Yes, on the neighbor islands, vector control employees are used quite heavily, from my understanding.
So you could use the CARE Act for that. Did you folks use the monies?
Senator Imai, this is Kathy Ross. I'd like to just speak on this particular issue. We know that
I don't think so, they got too many people.
Oh,
Yeah, you can go ahead. If you can get closer to the mic though, Kathy, because
we can't hear.
it sounds muffled.
Okay, we'll turn our volume on louder also. So when we had vector control workers helping respond to COVID, we were able to certify the portion of their salaries and to be able, our ASO worked to cover some of their personnel expenses, especially when it came to overtime. Many of them did work overtime and we were able to charge to CARES. We were not able to subtract their salary, however. And then moving forward, we don't have authorization to subtract their salary with CARES funding or CARES related funding.
Okay. Just a concern because, with everything that's happening with regards to health, I would think that you could use the vector control for more than your description and responsibilities. Okay, thank you, Chair.
Okay, Senator Moriwaki.
Aloha, hi. I have a question for Libby and maybe it's Danette. I like the idea that you're maximizing federal funds both on an ongoing basis as well as the relief funds. But so if you can answer for me on table 8, there's a to HTH 907, page 85 through 87. there's all of this COVID-related projects, and it totals about $116 million. And I'm just wondering why these are all A funds and not, N funds or P funds, and why aren't they? Kathy, yeah.
Okay, again, Kathy Ross. So this emergency appropriation was submitted to Budget and Finance and Governor's Office for consideration prior to us learning about the federal funds that are going to come to the Department of Health. So this is, as Dr. Char and Danny have mentioned, COVID, everything is happening so rapidly. So again, yesterday, I had a conversation with Budget and Finance, who is communicating with Governor's Office. We know, at least for the vaccination effort, we are going to be able to reduce the emergency appropriation request by the dollar for dollar what we're going to receive for vaccinations. So the 12.7 million, we're going to take it out of this. Yeah.
So all of this that says COVID response, there's a whole bunch of them on these 3 pages. Are they all going to go to N or P or whatever funding source?
Right now, that is our goal, is that once we know that the federal funds will allow us to cover these expenses, absolutely, we will charge these expenses to those federal funds. We only have official word on $12.7 million from the Centers for Disease Control for vaccination. So everything else that is not vaccination specific, we still have not received official notifications to CDC. And once we do, we will notify Budget and Finance, we will notify WAM and FIN about those changes.
So some of these seem like they would have been covered with CARES Act, the monies that were there for some of these kinds of services. They weren't offloaded and put into federal funding rather than A funds.
So last calendar year, when we had CARES funding available to us, we absolutely used CARES funding instead of A funds. What I talked about in the beginning about being flexible and being creative and maximizing federal funds, before CARES funding became available, we used in-house with the authorization, and we asked Budget and Finance to help front load some of our general fund allocation, so we didn't have to wait for federal funding, and we could start acting and executing contracts and services that we needed to. And
so whatever is reimbursed or whatever you can charge to that gets offloaded from A funds, do you have a plan for how to use the monies that come back into the A funds pot on the high priority areas that should be funded?
First, so when the money comes, excuse me, the sirens outside. So as soon as we properly reimburse the A funds with the federal funds, those monies are actually part of our base budget, and it gets utilized for the core services that we need to deliver beyond COVID. So those programs get their funding back into their program ID.
So can we get an idea, once you do have the money back into your A fund pot, where it goes and what is being funded? Because again, it should go to mission critical programs, and we'd like to see
it. Does, absolutely.
So if you can let us know what they are,
A fund,
come back in.
Yeah, we don't move the money all over the place. The A funds are used to fund expenditures from programs across the department. We're looking at ourselves collectively as a department. And when the federal funds become available, we make programs, we essentially borrow A funds from. So then they get their A funds back to do their mission critical work. So we're not getting additional funding. It's really paying back programs that have been allowing us to borrow those A funds.
But you have services that you need to be providing, and some of it you're trying to maximize federal funds, so you're using federal funds instead of state funds, so that state funds can go further in providing those same services. Is that correct?
Correct.
So I guess the question is, what are you then putting back in once you get the reimbursements back? on, from the federal funds, so that we know that these major services that are important to the health of the community as well as environment are being addressed.
Yeah, so it's Senator Moriwaki, it's Eddie. So it's a good question. So basically what happens is once the federal funds are authorized, once we get them back from the federal government and we can reestablish, we reinvest those funds, put those funds back into our general fund. So one example of that is when we started to do our isolation and quarantining, we didn't have CARES money available to us at that point. And so we were pulling from our general fund budget, our base general fund budget for last year, to kind of float that to get it going first. And then once the CARES money came down to us and I was able to access and just put those funds back, then those CARES funds went back into making the general fund whole like Captain talked about.
So they are funding.
Yeah.
I guess that's my question. Are we funding the priority programs once we do get the reimbursement, that it's going to the projects that we had and we wanted to have funded? So just one more question on the positions established by Acts Table 12, Acts other than the state budget. I noticed that there are like about 80 some odd positions in HTH 131, DOCTI, epidemiologists to screeners, field investigators, and they're all were established, they're exempt, temporary exempt, but they're all established in September, and it's still unfilled. And I'm just wondering, what are you planning to do with these positions? Because there are a whole bunch of them, 80. HTH 131.
Thank you, Senator.
Table 12.
Yes, I'm going to ask Dr. Sarah Campbell. This is the Disease Outbreak Control Division, and they received federal funding to support the work. So let me ask her to respond to that question. Dr. Campbell?
Hello, I'm sorry, can you repeat the question one more time so I can make sure I have it?
Table 12, there are about 80 some odd positions in HTH 131, established September 2 to this day, or at least as of November 30. I don't know if you've fired since, but they're all unfilled. And they're temporary exempt positions. They're not, don't have to go through the civil service system or anything. It's just exempt. So just wondering what happened to the positions. Are they needed? What's happening?
These positions that you're referring to are through the federal COVID award dollars, and they are to fund areas to improve and create a more sustainable health department response to this type of event in the future. So that includes broad areas of epidemiology capacity and laboratory capacity, as well as informatics for data modernization. There's also positions in there to support administration of all of those additional positions and funds. So that process has been going through getting the position descriptions corrected with HR and ready to post. We've been able to hire, the first wave of hiring has been for investigators, obviously an area of great need to address the COVID response priorities. And we are now working on hiring of infection preventionists. We also have additional managerial positions written in for the expanded offices and branches that we would need for data modernization and for coordination between epidemiology and laboratory functions.
So is the funds, these are all P funded. Are these all federal relief funds, or what funds are there just to support these 80 some odd positions?
These funds came through several different vehicles within the epidemiology and laboratory capacity grant, which is a CDC vehicle for
That the
funneling.
$50 million grant that you guys got?
There were several different buckets, but one was the Paycheck Protection Program Act grant, and then there's also one that they titled CARES, but it's on a different funding cycle than the CARES funds we've been referring to that ended December 31st. That runs through 2022. We also have a small bucket for community surveillance and for infection prevention and control. They all focus on similar project areas, so we sort of are thinking of those as a grand total bucket. That's about in the range of 60 million altogether.
They all go through 2022.
They all have slightly different end dates, but they're all through some point in 2022.
And they can fund all of these positions. These positions are all needed, and funding from these various sources are available to pay for these positions.
Correct. Those funds were made available for these types of activities, and the positions support those activities, and it's funded appropriately through 2022 for that purpose.
And they are in recruitment now, so that we are going to see investigators and prevention.
Correct. So some of, I don't know exact hire dates, but I know we have several investigators starting in January.
Okay, good. Right, thank you. Thank you, Chair.
Thank you. Senator Kanuha?
Thank you, Chair. I had a couple questions. First one about the vital records requests and the either reduction or abolishment of office assistants. You know, this has been a conversation for a while now. I think I spoke to the governor about it, about constituents and timeliness, especially out in neighbor islands, receiving their vital records in a timely manner. I know you guys were working on it, but with abolishment or reduction of office assistants, how much is that going to affect this particular function of DOH?
Hi, Senator Kanuha, Kathy Ross, and we also have our district health officers from Hawaii, and Maui online as well, and they can speak in particular to the neighbor island operations. But yes, as you said, there are a number, I believe there's five vacancies. 4 are slated for abolishment, partially because they were not funded last year, although we were able to keep the position number. We have been working on the improvement for our vital records program since 2019. As we've heard all of us talk about thinking through how do we, what are we doing and do we need to continue doing it, and how do we do it different, how do we better serve the community. And so we dramatically reduce the backlog, if you would, of people that are making the request, and the time from the request to the time that they receive the vital records. We know that there are still areas of improvement. We've been collaborating with WAM-HTH, in particular about genealogy requests, because they have very similar needs, and we provide that similar service. So we're thinking through how do we better serve the community with genealogy requests, so that we can work with the community in time between the request and the multiple requests needed for somebody to properly demonstrate. I actually have here in the office, I am very fortunate that Lauren Kim, who is our planning and policy manager, he also has, I think it was very willingly, he agreed to be temporarily assigned as our state registrar as well, because our state registrar did retire this past year. And while he was out on extended leave, Lauren Kim graciously stepped in to oversee OHSM and the revitalization that we've been discussing from 2019. So he has the specifics of the kinds of backlogs that have been reduced. But, you know, again, like I said at the beginning, we know we have to be part of the budget solution and being able to offer up things to help the state, you know, where we're at financially. However, those office assistants are very, very critical to our functions. They're our frontline workers. And so if there ever is growth, if the economy gets better, we would like to really be able to have some consideration into not just offer what we currently have, but look at being creative for servicing the labor islands as well, so that we can provide more same-day service, which we're not able to do at this point in time. And for equity, we'd like to be able to provide that same-day service on all. So with that, I'll turn it over to Lauren real quickly to just talk about some of them.
Thank you for the question, Senator. The office assistants are the backbone of the issuance office. We cannot work without them. With fewer office assistants, turnaround time will increase. You can make a straight calculation based on productivity and the amount of requests that come in. They don't slow down, by the way, especially with real ID. And we have, with the assistance of the legislature, contracted with OceanIT to do a needs assessment and to do a business process make sure that we have the most efficient, business practices to make use of what we've got. We also have a core system analysis taking place to make sure that we can replace our core vital record system. The IT software company does no longer exist, so we are skating on thin ice with about 20-year-old technology. So we do need to bring OHSN vital records into this century, the last century in fact. And we are sort of almost halfway there in terms of our assessment. The last point I'd like to make is we have learned lessons during this pandemic. We've had to shut down in-person visits. That's an opportunity to drive folks to online, which we are catching up on. In-person transactions just take longer, just because there's no back and forth. So, but that being said, we do recognize that folks like my 89-year-old dad doesn't know how to operate his smartphone. So we are looking at things like Kupuna hours, between 7 and 9 a.m. or something like that, accommodate those who are unable to do an online transaction. So we've learned a lot of things in issuing vital records from the pandemic, and we are accelerating the quality plan in 2019. And with legislature support, we're certain that we can accomplish timely production of certified copies, marriage licenses, and genealogy requests with your support. Any other questions, I'm happy to answer.
No. I just kind of wanted to get an update and hear from you guys the extent of what is taking place in upgrading everything to get the records to our community as fast as possible. I also, speaking about the district health officer, I know there was an acting one on Hawai'i Island. Was there any plans to hire a permanent for this position yet, or is it still acting?
Senator, so we do have, Kathy Ross again, we do have an acting district health officer. We are going into another round of recruitment efforts. As well as in our budget request, we've made accommodations and reductions in other areas because this was an unfunded position last year. So what we've done is we found, because it is so very important to us to have a full-time permanent district health officer, we've taken reductions from other programs within administration to be able to provide the funding for a salary for a DHO. So we've come through 2 different recruitment efforts. We've come very, very close to getting a permanent DHO. But like for all other things, prior to COVID, especially with the way the economy is, with the salaries that we're able to offer, and at the last hour, it just didn't work out. So we are going to go out for a 3rd round of recruitment, as long as we're allowed to make the adjustments in our budget to do so.
Okay, thank you for that. I also feel it's really important to have a permanent one there. Last question, Chair. I also saw that there's a reduction of air quality monitoring sites in the budget. Where were those monitoring sites, and how many were being reduced?
Keith Kawaoko?
Senator, yeah, with the budget reductions to meet those kinds of criteria, we did have to reduce some of the funding, in particular in our state lab.
air lab within the state lab. The specific number, I'll call on Marion Wong to identify the specific positions that we're talking about.
You know, if you don't have that answer right now, if you can follow up in writing to the committee and we can share that with the members.
Okay, thanks, Chair. We'll do that.
Thank you. Okay, Senator Ke'ohokalole.
Yes, okay, two questions, one for Eddie. I think Eddie, table 18, page 177, organizational changes. Looks like due to a reorg, you say that you abolish segments of the program that are no longer functional and variance to 50 positions. Can you explain that?
Thank you, Chair. And so basically, this is kind of a holdover for the Behavioral Health Initiative special project that happened towards 2009, 2010 with Felix consent decree. And so this is a close. All of these position variances are a closeout of that Behavioral Health Initiative program. All of those positions were essentially exempt positions from that time period. And so we were closing out that special project with the lid on it.
Okay, thank you. And then, Kathy, I know you said not to ask, but when is the CARES Act information going to be ready?
The CARES Act and how we use our funding,
Yes.
we will get that to you by the end of this week.
Okay, great. Thank you. Thank you, Chair.
Kathy, when do you guys expect to get additional funds and know the amounts and which programs they're for?
Sure, so the only thing that we know for sure from the federal government is for the vaccination program, which is the 12.7 million. We are expecting that money around the 19th of this month, but we haven't received a specific notice of award that's saying that the funds are available for us to draw down. We have been working with budget and finance, in particular to ready ourselves to be able to receive and allot the funding very, very quickly. So we're already working on doing the proper paperwork to increase our ceiling, increase that federal funds available, and allot it to our programs. And this is for vaccination efforts, but I want to be clear, it is going to support a wide range of activities and personnel across the department, not just within the disease outbreak control division vaccination program. We have staff from across the department that is working, including our pod at the Winwood Health Center, that Eddie Mercer and his team are spearheading for the department. These funds are going to be available to support those kinds of efforts across the department and into the community.
Okay, so are you aware of additional federal funds that will either supplant or supplement general funds that are coming down the pike?
So we are aware of, but we don't know for sure, about $81 million that should be coming in for through the epidemiology and laboratory capacity cooperative agreement that Dr. Campbell referenced. Again, it is not just for disease outbreak control division. We see this bucket of funding coming down for the greater good of the Department of Health and our community. So once we get notification, we will share the specifics of what we're allowed to expend those funds on. And we will make the appropriate adjustments to our emergency appropriations.
Okay. I'm not sure. Is the governor going to come down with some type of either emergency appropriation then to make amendments to, suggested amendments to the budget as you get additional federal funds?
Correct. We are working with Robert Hughes and his team at DNF to be able to track the allowable expenditures and what we can cover in our EA, and they will amend it on behalf of us.
Okay, because I'm assuming that's going to probably affect some of your filling of positions.
Well, we will see if we're going to be able to use some of those funds for our unfunded positions. However, a majority, if not all, of our positions that were unfunded last year, I believe, are also in our budget for reduction. So at this point in time, we would not actively fill one of those positions slated to be reduced, because we wouldn't want to trigger an adverse HR action for a full-time employee that would no longer have a position.
Okay, but that may change because the legislature has that prerogative, knowing that the financial situation may change because of the federal funds.
Absolutely. We will be in close communication with you to discuss how the federal funds can help our budget situation.
Okay, if we're able to move money along and get federal funds, are you guys participating in the WikiWiki program with DHERD?
For certain positions, we are, but we have not established that for all of our positions. What we do have for COVID-specific response activities is delegated authority to approve the filling of those positions in-house. So
Okay.
that does, it shortens the time it takes for us to get those positions filled.
Okay, because I think that's going to be part of our conversation. If some of these positions can get funded throughout this process, if they're on WikiWiki, I think that they're more than likely that that's something that we could leave in there. If it's going to be part of your normal process and it's going to take several years, then maybe that's something that we don't fund right away. So that's something that hopefully the department can expand on with WikiWiki. I know yesterday when we went with DOT, they're expanding WikiWiki quite quickly. They went from 6 months to hiring someone to 5 days. So hopefully that's something that you guys can work on.
Yeah.
Okay, other questions from members? I think Senator Baker, you have a question? No. Okay, any other questions? Okay,
you.
Senator Moriwaki.
Just to Eddie, I'm concerned always about the homeless, the most vulnerable in our community, and I know you've been doing a good job in terms of, I don't know if it's employees or you're contracting out for services, so I appreciate that. I'm just wondering in terms of maximizing federal dollars, what you're doing, and do we have funds in areas for past the pandemic?
Yeah, thank you for that question, Senator Moriwaki. So, first and foremost, yes, we are leveraging all of the federal funds that we have available to us, including our block grants, both mental health and substance block grants. Some of our discretionary federal fund grants, like our OD2A, which is our opioid data to action. A lot of those different grants we're leveraging to be able to manage and kind of figure out which pots of funding that we can use to kind of maintain the level of services that we're at. In this budget, we've definitely worked on trying to find that balance, that three-pronged kind of goal, doing our part to contribute to the budget, as well as maintaining kind of and finding better ways to kind of be more efficient, and then also maintaining the level of services that we need, and getting ready, I think, for the tsunami that I think is to come with behavioral health and homelessness issues as well. So we're trying to get ready for that as well, and we're using every dime that we can to number one, do what we got to do today, but also figure out how we can get ready for tomorrow.
And you are coordinating with the county so that hopefully the sharing of resources can go further, at least in this period and forward.
To the greatest extent possible, yeah. I think that, and for example, in Honolulu County, we've been really, really successful in being able to share kind of costs for stabilization beds, for example. And we'll continue to kind of work with the different counties to see if we can kind of to continue to do that. We just opened a stabilization site on the Big Island, which is a duplicate of a pilot that we did here about a year ago now. And so we're very excited about that as well. We'll continue to kind of try to expand that.
So are all the quarantine isolation centers that can be converted, I guess, as we don't have people who need the isolation, but can those also continue on? You have enough funding for them? Are they?
Yeah, so the goal has, my main focus is from March and April has always been to respond to the current crisis, but to find the opportunity in that crisis and figure out how I can establish and develop more infrastructure. And so primarily, I can't say for all of it, for all of the quarantine and isolation stuff that we've done, but primarily for most of the quarantine and isolation stuff that we've been able to put in place, we are prepared to continue to do that beyond, at least for the next 2 years.
Good. Okay. Thank you. Thank you, Chair.
Thank you. Senator Kidani.
Thank you, Chair. Dr. Char, in the rest of the states, the counties pay for their own EMS services, and yet here in Hawaii, we pay for it. In the rest of the states, the counties also pay for education, and here in Hawaii, they do not. We pay the full amount. And in the past, maybe it's been okay because we've been able to do it, but this year is a different year. We are taking hundreds of millions of dollars away from our students through weighted student formula, et cetera. Don't you think that the counties should share some of the burden and let them, and we should, reduce the funding that we're giving to the counties for EMS so that we can give it back to our students? Have you guys looked at that?
Senator Kidani, this is Danny Wantoyasu.
I can hardly hear you.
I'll just come closer. Senator Kidani, this is Danny Wantoyasu. We have not had that conversation. We do know that the EMS system, the way that it's currently structured, is not sustainable. So we are really working with the counties to figure out how we can best maximize and leverage their resources as well, so county resources, to be able to support the services needed for EMS.
Thank you for that explanation, Danny. And I'm, as chair of Education Committee, I see how our students and our teachers are suffering because of what's going to happen. They've already had to pay out, quite a bit of their weighted student formula just to pay for PPEs that was not funded, in the beginning. But I think it's time we have that conversation, and this year at least ask the counties to pay half of the EMS services. That way we could at least give $100 million back to the DOE's budget. So I think this is a time that we had that conversation. And I hope that you guys would consider starting that conversation. And, I guess if you remember, maybe a month ago, then Mayor Caldwell made when the governor announced that we were going to do furloughs because of the dire situation, the mayor went on public TV and said, the counties would not be doing any furloughs. Well, I'm really happy for county employees, but on the other hand, I'm very, very sad for our students and teachers. And we need the funding for our students and teachers. And, especially the teachers, they're paid much less than, county employees. So I think it's time we have that conversation, so please consider it.
Okay, any other questions for Department of Health? Okay, thank you. Oh, Senator Baker.
Just one question. And I know that it probably involves HHSC, but I think the ball is probably in Department of Health's court. We have spent considerable resources at the state level to improve and fix up Leahi Hospital. And we know that there are needs in a community for additional either bed space for folks with behavioral health issues or some other kinds of health issues. So I'm wondering what the Department of Health is looking at to try to make sure that we utilize Leahi to a much greater degree, and then we go and look at Maluhia that has the possibility of, with very little effort, having some additional space there for some folks that may have other kinds of issues but are aging.
Thank you, Senator, for that question, Eddie, again. So we continue to work with Oahu Region HHSC to discuss the possibilities of partnering and continuing to partner with them for utilization of both of those facilities. As you know, the bills, both of the bills, there were 2 bills last session that discussed the idea of transitioning the Oahu region back to the Department of Health so that we could utilize those facilities more effectively and adeptly. And they both passed through their second chambers, and so they were well on their way, I think, to going to conference. And then COVID hit, and so I think the discussion, there has been some discussions about picking this up again this session, and we've had conversations with chairs on both of the House and Senate side to look at that. So it's still on the table, and we just, you know, things are a lot different now than they were last March, and so we would want to make sure that we consider all you know, all factors as we move forward. But I think for the most part, all of the parties that were supportive of it last year are still generally supportive of the idea.
So if Senator Keohokalole and I put in a measure that would address that, we would get some support from the Department of Health.
Absolutely.
Thank you. Thank you, Chair.
Thank you. Okay, any other questions? If not, adjourn.